Okay, so today I want to discuss and talk a little bit about the use of deca or nandrolone with TRT. Very popular. A lot of guys use it for joint pain, inflammation. A lot of older guys really like it, but then some people still have issues sometimes in regards to how they feel, as well as libido affecting their erection quality, etc. And a lot of guys will run a 2-to-1 ratio. Where this came up with was just basically back in the 80s, I believe, in bodybuilding, that guys tended to have better libido results when their testosterone that they were taking was about 2 times greater than that of nandrolone or deca use, and that seemed to help manage or improve their libido. So it's always that 2-to-1 ratio seemed to work well, but it doesn't always work that well in everyone. Some guys are fine with a 1-to-1 ratio. I've had plenty of clients that were taking just as much deca or nandrolone with their testosterone, didn't have any problems or issues. I, for one, didn't have any problems or issues when I was a lot younger, even using deca or nandrolone by itself without any testosterone or TRT. So just to go over a couple things, that deca or nandrolone does have a greater binding affinity to the androgen receptor in most tissues. However, it is somewhat tissue selective. So in a study that was done comparing the binding affinity of the androgen receptor in different tissues, that DHT actually had greater binding affinity than obviously testosterone or even nandrolone in the tissue, so such as seminal vesicles or in prostate tissue. Also, that there, which this may not necessarily affect libido, but the nandrolone had a greater binding affinity, especially to muscle tissue. As far as the joint benefits, that there is studies showing in postmenopausal women that taking nandrolone or deca increased collagen synthesis, such as another study shown here, and also that nandrolone itself actually stimulates estrogen receptors. This might be why that it actually has a negative impact or effect on libido, or sometimes even mentally, because it does seem to stimulate or attach to the estrogen alpha receptor with a significant binding affinity, therefore blocking out normal estrogen or affecting estrogen metabolism. So deca also, or nandrolone, attaches to progesterone receptors, which can have a negative impact on progesterone. Progesterone actually helps downregulate estrogen receptor sensitivity. So this is why progesterone is especially